Western Spring Television. Ours it is.
An apple a day keeps the doctor away. This old English proverb was first coined in 1913. It was based on a Pembrokeshire proverb that originated in 1866, which meant eating nutritious food like apples will make one healthier. Therefore, one will not need to visit the doctor often. Although research shows that eating more apples may not necessarily lessen the doctor's visits, it can help improve many aspects of one's health. Well, in order to even it out on both sides, patient, doctor, let us agree that an apple a day keeps the doctor away. But if the doctor is cute, forget the fruit. It is with such delight that I welcome you on board this brand new broadcast of Spring Clinic live from the Western Spring Television studios. My name is Temitope Ajijola Oluwola. Sincere appreciation to the esteemed Dr. Adeoye Oyewole, who built the foundation for us to thrive on the show. A Spring Clinic will delve into everything health and well-being, so we can help you not only to feel better, but also bring you information that will help you reduce the risk of diseases, lengthen your lifespan, save you money, and benefit the environment. I will not be on the broadcast alone. We will be having the honor of our on-air medic, seasoned family physician with over a decade's worth of experience under his sleeve. Dr. Ayodeji Ogungbemi, taking us through every session, step by step, and every now and then. Specialists in the different fields would also be joining us to shed some more light, offering and their expert opinion. Today, we will be starting from the basics. What is health? Or rather, what is good health? Be not dismayed, dear viewer. I am just a man like you, willing to learn more about my health and get better at it. Dr. Ayodeji Ogungbemi is on the set of Spring Clinic today. Thank you for coming on the show, Doctor.
Thank you very much.
Good afternoon, sir.
Good afternoon.
So let's take it from the very beginning, Doctor. What is good health?
Thank you once again. Good afternoon, everyone. Before I answer your question, I need to appreciate Dr. Oyewole Adeoye for the wonderful work he has done so far. Not only on Spring Clinic, but he's also a teacher to me. And he trained me in school as part of my trainer, so I respect him a lot. Having said that, let me go to your question.
Yes.
And I want to appeal that our viewers shouldn't expect big vocabularies, because the purpose of this program is to reach out to them, not to give them big terminologies that they'll have to open a medical dictionary to look into. So what is good health? Good health is a state of physical, social, and mental well-being. Not only the absence of a disease. Long before now, the thinking of what a good health is only about an absence of disease. That's why you find somebody, you ask someone, how are you? He says, I'm fine. Because he has not been to the hospital, because he or she is not having a headache, he or she is not having cough, he or she is not having abdominal pain. And the person says, I am fine, because he or she is not hypertensive, is not diabetic, you know, and they say things like, I'm fine. That person may not necessarily be fine. So the World Health Organization went further, because medicine is growing, is increasing. And I also need to say this, that I'm also like a human being like you.
Yes.
And I want to know more myself. So it's beyond being sick, it's now being well. Because being sick, the goal of whoever is sick is to survive. Whereas the goal of well-being which is what we're advocating for now, is to thrive. And that's why the new concept is there. So it's about physical, social, and mental well-being. So you can put it like this: physical, social, and mental thriving in terms of one's health, in terms of one's life, as it were. I know you may want to, maybe I should just talk more on that before we move into other things. So I'll cite an example. Physical well-being, I'm going to talk about things like your weight, your diet, your exercise, which, if not well addressed, may lead to an infirmity, that is, may lead to a disease condition. Let me give you scenarios. Anybody watching? That one is not sick does not mean that one is fine. Someone may tell you, I'm exhausted, I'm fatigued. That is not, as it were, a disease condition, but it's a state of the person's well-being. That is, there's a problem. Social interactions is there. If I come here and I nag, there's no disease condition on nagging, but it's not a good social interaction. That I can't relate well with a colleague is not a disease condition. That I'm frustrated is not a disease condition, but whoever is frustrated is not well. You know, when we say mental well-being, I'm trying to break it down, does not mean the person has a mental breakdown. It means that the person is mentally stable. You know, let me crack a little joke here. Presently I work at a very busy unit in the hospital, and usually I speak to psychiatrists. You know, doctor, what is us a psychiatrist? And I speak to psychiatrists. I tell them, don't you think you should just evaluate us? That the kind of cases we see, I see horrible cases, you know, at the emergencies. I see trauma cases. I have to deal with the emotions of other people. I have to deal with traumatic cases. So I tell them, if I see all this every day, and I've seen it every day for the past few weeks to months, do you think I'll be okay? I think I need an evaluation. Now, I'm not sick, but I'm talking about mental health. Have you also seen, I'll give you the scenarios, people that work in the morgue. You know, there's a way they talk to people because they deal with dead people. So they don't, and somebody saying, I don't want to die, they're like, what is there? You know? So they don't have a disease, they may not have hypertension, diabetes, stroke, and the likes, but we need their mental health, we need to really evaluate it. That are they still on the border of normal in terms of social interaction, and in terms of what they see to be normal and what they see not to be normal? So putting all this together, good health is now far beyond not having a disease condition. It is now about your well-being, both physically, socially, and mentally. Maybe I should put a stop there.
All right. Because I was going to ask if there are types of health, and you've mentioned good health, mental, physical. Are those types of health, or there are other types of health? Good health.
Okay. It is not that we have a type of good health. Good health is good health. And when we are talking about good health, just as I started, it's a holistic thing. I can't separate one from the other. I can't say that you have a good physical health, but you don't have a good mental health. Well, we may say that maybe in the teaching hospital or for teaching sake, but really a human being is a human being. And whoever has mental well-being issues will soon have social well-being issues, and will soon have physical well-being issues. Let me give an example. If I'm not interacting with you well, I have poor social network, I have a poor social interaction, I don't have anybody I can call a friend amongst my colleagues, I tend to do my things alone, no interaction, poor interaction. It's just a matter of time, it will start affecting my mental health. Then a time will come, it now starts to come into the realm of a disease condition. Then I may be paranoid. I may say things like, they don't like me, nobody wants me, I'm just on my own. Then if it keeps going on like that, frustration will come in, poor job satisfaction will come in, poor relationship issues. Then just a matter of time, things like blood pressure issues might start coming based on that. Then it will also affect the choices the person will make. Because if I'm to make a decision, even as I'm seated here now, if I make a decision, I have to put on the table so many things. But if I can't interact with a colleague effectively, my decisions will be poor. It will get back to me. Maybe I need help. I can't reach out to you for help. Then I have to try to do everything by myself. Then the time comes, I must start to have issues. So with that has brought medicine into a state to talk about holistic health. So when we're talking about good health, so it's not something we should really separate. We should talk about holistically. Is this person fine? That is, we have considered both the physical, the mental, and the social. So under the social, we talk about emotions. No, we talk about social interactions. Under the mental, we talk about psychologically, we talk about emotionally, you know. So based on your question, I want to say we don't need to differentiate. We just need to put it holistically. Is this person well? Because they are intertwined. One will lead to the other and then back to it, and it keeps going on and on.
So, doctor, physical health, emotional, even financial health.
Yes, finances. It's part of the social interaction.
Yes. Can someone, a person, be completely healthy without free of diseases, free of financial issues, bothering the mind, free of stress, free of emotional breakdown, free of depression, free of physical injury, and all of that? Can a person be completely
well,
wholly healthy?
That's a very big question. And that's like, you're not fair to me. Oh.
I'm sorry, but we all want to get to know.
Can one be, maybe transiently, but that is the goal. And I'm speaking as a family physician now, because we don't only, that's not just about family medicine, everything is going holistic. And what do I mean by that? Number one, when you talk about things like this, you look at genetics. Plays a role. I don't have a choice over my genetic composition. My genetic composition spans generations. My dad, my mom, my dad's dad, my dad's mom, my mom's dad, his dad's dad, his dad's mom. I have contributions, I don't know how many generations back. I don't have a choice over my genetic composition. My genetic composition will determine the kind of liver I will have, will determine the kind of lungs I will have, will determine the kind of organs I have, the kind of skin I have. Likewise, it also determines some disease conditions people may have. So that's one, and nobody can alter that, as it were, the composition. However, the manifestation of the composition is another thing, and that's where we bring about the environmental component. Now, the environmental component can be modified. For example, we say things like your diet, you know, that's part of the environmental component. Even at the environmental component, there are the modifiable ones, the non-modifiable ones. Life stressors, there are modifiable ones, non-modifiable ones. The road I'm going to pass through my house, I can't modify it. That is part of the environmental factor. That's part of what the government should do. But if the government does it or they don't do it, it has an impact on my health status because it will increase the stressors I'm going through. So I can determine what I eat, you know, but I may not be able to determine the road I pass through. Very important. I can determine the choice of my career. I may not be able to determine the environment of my career. For example, when we talk about the work settings, my employer is meant to determine that. So if the work setting is not good, it affects my mental health because if it's a highly stressed environment, then it affects the mental health. So as you asked, can we have somewhere that is 100% well? Wow, I'm not sure we can, but we keep pushing, we keep getting better because we have the modifiable components and the non-modifiable components. Let me give you another scenario, because on this genetics, I can keep talking on and on. It's not just that one's genetic composition. it's also about the degree. So it's not just about that we have a genetics. Okay, let me use diabetes mellitus. I think using a disease condition will help. We have diabetes of different types. There's a type, now medicine makes us understand that all the types have genetic composition about it. A type starts early, a type starts later in life. So basically 2 types. The third type, generally speaking now, is associated with maybe pregnancy. So you have type 1, type 2, and then pregnancy induced or pregnancy based. But even the type 1, type 2 are now merging. But what I'm trying to say is that there are some that from childhood, they have to be on insulin. It is not the child's fault. That is something he got or she got from both parents. And there are some children that they have diabetes mellitus, but may not necessarily be on insulin because the type or the expression of the genetic components of diabetes mellitus that child got from the parents varies from one to another. So, addressing that question, it's a big one. It's a really big one. It's a big one. But we keep striving, and we keep modifying the modifiables. While we keep looking at the non-modifiable to see if people that should help do something about it can do something. That's particularly about the environmental factors. Then there's a third component to well-being, and that's where we talk about the emergencies. I like to say from my experience and from what I know, emergencies can also be on 2 categories. Number 1, there's emergencies that are due to carelessness. For example, somebody is diabetic, did not treat himself well or herself well, has not been going to the clinic well or follow-up, has not been using medications well, then comes down with a complication of diabetes mellitus, and then comes in as an emergency. That's a different one. To me, that's due to carelessness. Now, there's another type of emergency. That's one I really call emergency. That is, it is not the person's fault. And trauma falls largely under that. Somebody leaves his house in the morning, a careless rider slams on the person. The person, it's not the person's fault, really. He's a pedestrian walking where he should walk, or maybe a driver, a tire got faulty. He did a good checkup in the morning. You know, there are some drivers that don't do good checkups in the morning on their vehicles. So he did it, but something went on the road, brake failure, things like that, and an accident happened. That is unplanned for. That's an emergency. That is, well, they're both emergency, but that's, you know, so yes, it's not something the person planned for, waking up in the morning, and it's not due to one's fault, as it were. So that is also happening to somebody, which can affect the well-being of the person or people around the person. You know, I don't know if I'm communicating.
You are.
Yes. So the genetic component is there, the environmental component is there, then my own terminology now, the accidental, unplanned component is there. Something, for example, you talked about financial now. Nobody, as at last month, or maybe last year, while planning for this year, I don't think anybody planned dollar naira will be this way. So it's going to affect a lot of the mental health of people. It's affect the social health of people because couples may fight on this and things like that. Then another component. I'm sorry, I'm just
several components.
Another component is coping mechanism. Despite all these stressors, individual people have different coping mechanisms. I like to break it into 2. Okay. We have the inherent coping mechanisms, and we have the acquired coping mechanisms. That is, there's a way everybody looks into coping when they're under stress. And the acquired is the one that everyone should learn. That, okay, irrespective of my own inherent coping mechanism, which may be good or bad, I need to now learn the good coping mechanism. You get it? So that will also affect the health, the well-being of people. The stress is there. The non-modifiable factors are there. A disease condition may be genetically caused, may be there. How is the person coping? A vivid example is this. Somebody has diabetes mellitus, or 2 people have it, person A, person B. They are both on insulin. one has a good coping mechanism because anybody that has diabetic mellitus will visit the hospital more frequently. We have more tests done than somebody that does not have. So it is possible that there could be, in fact, different studies have shown that some people that have these chronic conditions may be more depressed than an average person that does not have these conditions. Now, amongst those that have, there will be some that are coping well, which may be due to their social environment, maybe the kind of environment they belong to, their parents, their family. It could be supportive, workplace may be supportive, the country they belong to or they are living in may be supportive. It will be different from another person. So the coping mechanism also affects how they manage such conditions. And these are factors that will come into the well-being of a person. So let me just stop at those 4 points because I can't keep.
Yes, I
Talking and
was
talking.
already getting lost in all of this. But, doctor, you have talked about the fact that all of these health factors, or I would say types, the mental, the physical, and others, they are somewhat intertwined.
Yes.
If I feel like I don't have a good relationship with my colleague, or something happened and I didn't handle it well, and I see it from what you said, maybe a health issue, should I just go to the doctor? Is this something in Nigeria? Let's talk about it. I mean, in other climes, it might be seen as normal. But in Nigeria, would it be seen as something worth visiting the doctor for?
Yes, I understand that question very well, particularly in the context of Nigeria.
Because I was still going to ask if I have been to the doctors several times. I mean, hospital environment. I see people bringing in physical health conditions like injuries, headaches, fever. But I hardly find someone saying, doctor, I think I'm thinking too much. I need your help. Or I was speaking with my child yesterday, I snapped. I need your help. Does it really happen? And should we just get to the doctor's place when this happens?
Well, let me talk about the ideal, then talk about Nigeria. Because you want me to open a lot, but this is to help people, and I believe policymakers are also listening. So let me say, the ideal is that the answer should be a yes. The answer should be a yes. I'm not saying it is a yes. It should be that. The ideal should be that your doctor should be like your next person. In fact, the concept of medicine now, particularly if you talk about family medicine, is that there should be a doctor that knows you for you. And maybe I'll still talk about it maybe later in the program. A doctor should know you for you. By the time you're saying that I am your doctor, it's not just about you came, I've seen you twice. I should be able to tell you, if they mention your name, I should be able to say this is her name, this is her age. When she was young, she had these issues. When she was a teenager, she had these issues, this and that. This is her blood type. These are temperament. This is this. Being a female, these are the female issues she has. Okay, childbirth. She has a history of this. I should talk about you. Just like, maybe not like God, the way we talk about God, but I should talk about you, for you. That is something we are moving into. And that's something that should be. But in the context of Nigeria, which is the real question you asked, it has not been like that. Though it should be like that, but it has not been like that. And let me speak now. It has not been like that because, number one, there's a narrative that we are not yet imbibing. The narrative is that we are coming from the curative aspect to the well-being aspect. The developed countries they left curative medicine a long time ago. So we are just imbibing the well-being aspect. That's why different hospitals now are now coming with wellness clinics where the person does not have a complaint. He just come. He doesn't even have a complaint. He just come in and they are talking about diet, talking about his weight and things to do, how to behave, how to talk. We're having a lot of counseling coming up, a lot of issues like that. Not, go and use this drug. Are you sleeping well? Are not sleeping well? So, and because of other factors in the country, there's been a drag in that transition. So, one of the factors is, I was smiling when you asked the question, when you were given the scenario, that if somebody comes into an average Nigerian clinic now, average Nigerian hospital, and says, doctor, I want to see you because I snapped yesterday, the doctor will look at me and say, even me.
I snapped too.
Even me. In fact, I will snap at you now. Well, it shouldn't be like that, but there are a lot of other factors that we are not putting into place. Number one is that even the doctor is not happy. Even the doctor is not well. Let me not use happy now. He's not well or she's not well because of other factors. And I think these are the factors. If you look at, oh, you've asked me a really big question today. Do you know why the developed countries are picking doctors and nurses from Nigeria? Because they are looking far beyond, they have gone far beyond the curative. It's not just about a disease condition. They are looking into what the medical practice should look like. Everybody should have access. I should be able to speak with a doctor. But we are not seeing it yet. That way we see it as you need a doctor when the person is about to die. You get it. So that's why, before coming here, I had an interaction with some of the doctors in my unit. And we are saying things like, we are expecting a big problem very soon. We're already in a big pot of soup, but it looks like we'll leave the pot and go into the fire. Why? People have financial issues now. They can't get their drugs because it's now expensive. They don't have money for it. So it means that they will likely go tradomedical. Now, I'm not speaking against tradomedicine. I believe some of these herbs and co work, but we have not investigated it well enough to look at the impurities and the dosaging. Now, and I believe we've had enough time to have done that, but we have not done it. So people, then a lot will now stay at home until when we now have complications. Presently, we're having issues of increased chronic kidney diseases, hypertension coming as complications. But with this economic issue, I'm
going to hold you right there. We need to quickly go pay our bills here.
Okay.
All right, viewers, if you've been listening in, you'll see that we've had an interesting conversation up until this moment, but we'll be taking a break now. And when we get back, Doctor will take it right where we stopped.
Up to 75% of human infectious diseases originates in animals. And as more bushmeat is brought into our cities, the risk of human infectious disease outbreaks increases. Ebola, monkeypox, Lassa fever, yellow fever, and even COVID-19 may have been transmitted in this way. Illegal bushmeat trade not only endangers our wildlife, but affects our health and may damage our economy. So please, say no to illegal bushmeat. Keep them wild and keep us safe.
James Ajibolaige was a lawyer who obtained his first degree in classics from Nigeria's premier University of Ibadan. Born September 13, 1930, the orator and the polyglot spoke impeccable English, French, Igbo, Hausa, and Yoruba languages. His fine diction placed him among classical orators and public speakers like Cicero, the Roman orator. This attribute earned him the prefix Cicero of Esauke. He authored Kaduna Boy, an autobiography, Detainee's Diary, Constitution, and The People, among 6 other books. Bolaige was a colorful politician, elected governor of Oyo State in 1979 and appointed a federal minister in 1999. He was a pioneer founder of Afenifere, the Yoruba social, cultural, and political group. He invested his political sagacity to propel the group to the height of political leadership and decision-making in the southwest of Nigeria. Bola Ige was assassinated on the 23rd December 2001. His murderers are yet to be apprehended till today. Western Spring Television identifies Bola Ige as a watershed character in history.
Illegal bushmeat is not cool, but it's on sale in our cities, risking extinction and our health. And many of our iconic wild animals are threatened. So please be cool and say no to illegal bushmeat. And let's make Nigeria better for wildlife and safer for us all. Keep them wild, keep us safe.
Thanks for keeping faith with us on Spring Clinic on Western Spring Television. And it's been an interesting conversation with Dr. Ayodeji Ogungbemi here on the show. And we've been talking about what good health is and all of the factors surrounding that. And it's really been interesting. And the doctor was saying something before we went on break about curative medicine and how what the ideal is and what it is not.
Yes, you asked the question about people coming to the hospital and just for wellness sake, not for disease condition. And I said one of the major problems is that even the doctor, that should be the normal thing. But we have a problem in the context of Nigeria because even the doctor is not well. Maybe well physically, but may not be well socially, may not be well mentally. You know, we have defined wellness that it is not about it's not just about absence of disease condition. I'm not saying that they have psychiatric problem, but I'm saying, for example, a lot of them are stressed. So when it comes to a stressed environment, what we look at, because I'm also a doctor, so you know, I tell people that sometimes when you see me somewhere else smiling, I mean, not necessarily smile in the hospital. You know, when people are stressed and we have volumes of people to see, then you now start talking about prioritization. You prioritize who is going to, who will die if I don't intervene. So then the person that has a complaint on just wellness will be pushed aside. I once told the client many years ago now, so the person told me that she had a headache, and I said, I would treat you, well, madam. I'm sure that my headache now is more than your headache.
By your magnitude.
You know, that's an example. So it's a big issue. And if I'm to address it, as I said, policymakers will be listening to this also. The jackpot problem now will increase that. You know, I have a friend that relocated recently with his family, that before relocating, he was doing well. He's a major person in his specialty. He's doing very well. It's somebody that, even being a contemporary, I look at him like, I want to be like you. And then he told me he has got an offer and he's leaving because of job satisfaction. There are some things he would want. No, I'm using it as a case scenario. There are some things that a doctor will want to work with. That's where we come to infrastructure. Absence or inadequate infrastructure will affect the wellness of the people. Because if I don't have what to work with, I will have a problem attending to you. And the way the government prioritizes these things is such that they look at what people will see and things that are curative. So in their purchase, they will get things that are curative and they're not focusing on things on well-being. If I'm going to attend to you on well-being, I will need time. I will need time to talk to you, to know what the real problem is. So it's not a 5-minute clinic session that will let me know that your problem borders on marital issue, though having a manifestation in your social interaction. Let me give you another scenario, a very common scenario. Sometimes people come to the hospital and they give complaints like having, maybe, let me give an example, maybe low back pain. Or the low back pain is common, only to find out after good interaction with the physician that the problem is not a low back pain, really. The problem is that he or she has a problem with the spouse. So it is that problem that the person has, how should I use the word, adjusted and is now having a physical manifestation. Such person will do different tests and everything will be normal. Until you have quality time to engage that person, until you find out, okay, it's marital. Okay, let me speak with your spouse. Can two of you come around? I can't do that in 5 minutes. But I have a lot of clients waiting outside telling me, doctor, I've been here since 8. You saw person 1, 5 minutes, person 2, 5 minutes, person 3, 5 minutes. This person is inside. You are spending 30 minutes. In fact, you find some very vocal patients who will come and knock on your door. Oh, sir, we are waiting. So it's a complex issue. And I believe that it's so complex, but I believe it's so easy to do. It comes from the top. If it's a priority for government, then, let me not just say government, for leaders, then we'll start changing narrative. And it will affect what we get. It will affect the kind of clinics we have. Most hospitals that are being built, I'm not talking about the private ones, they are not built to accommodate wellness. They are built to accommodate curative medicine. How many consulting rooms do you find in many of these public hospitals? Even in the clinics, how are the clinics built? The clinics are not built in such a way that you have to be relaxed for me to talk with you. The clinics are built in such a way that I have to see you on time and you go. I don't know if I get my... So it's a big issue. And let me say it's a big issue. It's a national issue. It's a big issue. It's a national issue. Maybe I shouldn't talk too much.
No, you're not.
But I need to say that that is what should be. I should be able to go to the doctor for any reason. You know, when I was coming up, I need to say this because people are listening. A lady came from Germany and came to the clinic I was in then and told the nurses that she would have a seizure very soon, that she would convulse. And the nurses were looking. What do you mean you will convulse? You walked into this place, you are telling me I will convulse. So they were just laughing and they were like, madam, are you psychologically okay? Because what they had been exposed to over the years have been curative. That is, they bring in those that are convulsing. A normal person, apparently normal person, should not say, I will convulse. Now, that's an example of where she's coming from. That's an example of the level of their healthcare, where she's coming from, and our level. This lady is a known seizure disorder patient. She had mastered herself with her physician in Germany that she knows the aura. There's a feeling they have pre the seizure. Though in terms of knowledge, that feeling is also part of the seizure, the manifestation of the seizure. But the person knows that something is about to happen. And they have been trained that when they have that feeling, that aura, they go to the hospital so that she doesn't just fall anyhow. Then they can administer necessary medications and prevent it. So these people started talking to her, are you fine? I hope you are okay. And then she convulsed. It was then I got to know, I ran out, okay, because you would hear, you know. Got there, I convulsing, then they now said that she was telling us that she would convulse. So I had to educate them because they had been used to curative. They are not being used to the well-being. So you can see that it's even affecting the training. So that's why I said it's a national issue. Our leaders at the top must really sit down To draft a path, presently, I don't think there's a path. We are just doing what we know. There should be a path that, okay, this is where we want to take Nigeria's health care into. Yeah, I don't want to talk too much of government issues.
Doctor, we've been enjoying you really. But there is something I would like to ask before, it's time up on the show. What are the ways that a person can preserve their wellness, both physical, well, maybe not physical, because like you talked about emergencies, but emotional, especially in our client, Nigeria? How do we preserve our good health, the little one we have? How do we preserve it?
I like I like the way you are putting it. Yes, well, as I said, we may not be able to separate it, both physical, mental, social, the ones we can modify. Let me start from the very common ones we know. That's the physical side. The physical side, or generally speaking, people should be close to their doctors. You have the choice of looking for the kind of hospital you like and the kind of health care worker you like. People should even, I advocate that we should even dig deep into knowing the competencies of the hospital you want to use and the physician that you want to adopt as your family physician. Look into their competencies. Not everybody is as good as, we are not equal. That's one. Then there may be peculiarities, So maybe this person is a specialist in this area. I rebuked somebody, a friend of mine recently. He's a non-hypertensive, was not using the drugs well, and told me that it was under specialty doctor that gave her the medication. And I rebuked the person. I said, that specialty doctor, there's a way each specialty thinks. If you meet a nephrologist, there's a way, if you tell them you have hypertension, there's a way a nephrologist would think. Though there's a common ground for everybody, but based on their specialty, there's a way they think on kidney matters. So dig deep, investigate, and make your choice. That's one. Two is that there must be regular checkups. Now, and here comes the periodic medical assessment, which is what I said I would say earlier. The periodic medical assessment, medical now is not only physical, both physical, mental, and social. The periodic medical assessment or periodic health assessment, some people call it medical checkup, is for apparently normal people. Apparent, that is, the person doesn't have a complaint at that time, but goes for a checkup. So with that checkup, because the person is apparently normal, we will know the apparently normal state of that person. Because when people come in a disease condition, their parameters are altered already. Maybe I should give you an example here, maybe a test.
What time?
You don't need to answer. If I ask you, what's your normal PCV? You may not know, and you may know. Most people, you know it? Yes, okay. Most people know the one that was done when they had a disease condition. So they may tell me it's 33. Though 33 appears low, well, let's say 38. My next question would be, this 38, was it when you had a disease condition or when you were apparently normal? If it's a disease condition, then this PCV is not the normal for you. Now, if there's a good periodic health assessment, the PCV would have been done at different times in an apparently normal state, that I will know the normal range for you. Because what we do in medicine is that there's a range for everybody. We say adult PCV, maybe 38 to 48 for a male.
You see, doctor, we could take you all day, but we really have to go now, really. I mean, they're already disturbing to go.
No problem.
Viewers, you have heard, you should get your periodic medical checkup for your good health to be preserved. And it's been an amazing and beautiful time, interesting conversation with Dr. Ayodeji Ogungbemi here on the show today on Spring Clinic. So going home today, I'd say an apple a day may not keep the doctor away, but it's a healthy choice anyway. So looking forward to seeing you next time on Spring Clinic. My name is Temitope Ajijola Oluola. Bye-bye.